In all surgical patients, we recommend using multimodal pain control if that's possible. Obviously, there's some groups of patients where that's not possible, but pretty much in every surgical patient, we've always recommended multimodal pain control with both NSAIDs as well as acetaminophen and then narcotics if needed. Our study looked at that as well. We actually found that majority of patients were taking kind of the non-opioid based pain medications even before our guidelines came out. And now still over 80% are using non-narcotic pain medications, but still about half need narcotics after major surgery after discharge. And so those aren't always enough. Our goal is obviously to rely mostly on the non-narcotics, but we do know that some patients will need narcotic pain medications after some big surgeries. And so our goal is to make sure we give them the right amount, both in terms of reducing how much they get in terms of the opioids, but also making sure that we don't reduce it down too far and then leave them in pain. I think the next step for me is really to use this data from this current study to really try to identify those patients who may have lower scores in terms of pain scores after discharge with the reduced opioid prescribing guidelines. We'll then have to figure out what to do about that. And as I said, we don't know if the right answer is maybe more non-opioid based pain medication, maybe it's slightly more opioid based pain medications, or maybe it's just setting expectations appropriately. But I think there is a small subset of patients who we're not optimally managing yet. And while that's, obviously a very small number, I think that's a critically important small number because everybody should have their pain appropriately controlled after surgery. We want to make sure people are comfortable having surgery and not worried about having uncontrolled pain afterwards. And I think we need to achieve that in 100% of patients. And this study is aimed at trying to get us closer to 100%, not just in the high 90s.